Welcome back. The show is Comments, and the topic is Meharry Medical College, and we're talking to the president of Meharry Medical College, Dr. DSatcher. And Dr. Satcher, before we had our break, we promised that we'd like to deal with the whole question of the merger between Meharry's Hubbard Hospital and General Hospital. Perhaps you would like to start us off by giving us some information in reference to some of the problems and perhaps the history dealing with this merger and why you believe it to be important.
Okay. Well, let me start by perhaps defining the proposed merger. Basically, we have proposed that because of the deteriorated condition of the Nashville General Hospital, and the fact that it has been recommended that that hospital be closed several times, we have proposed that the city now move to close General and that those services be consolidated into Meharry Hubbard Hospital, and that be done over a period of 1.5 years. According to our proposal, the city would continue to be responsible for the management of indigent services, and the city would continue to contract with Meharry and Vanderbilt for the physician services, just as it does now at Nashville General Hospital. As you know, we announced this proposal on November 28 to the Rotary Club, presented a concept proposal to the hospital board on December 15th, and a formal business proposal on February 7th. A committee was established to examine our proposal, and 2 weeks ago that committee recommended that the city move toward the merger of the two institutions.
Now, you've had quite a bit of support in the press in reference to that. As a matter of fact, I think we recall reading editorials in support of that proposal by both of the newspapers. And there's also some suggestion that perhaps the mayor is sort of leaning in terms of supporting that proposal. So do you consider this to be a way to overcome most of the problems, or do you still see some obstacle in terms of keeping this from becoming a reality?
Oh, I think there's still hurdles that we have to overcome. I think the proposal is a solid proposal. It is solid in that not only would it provide a major facility for the city to use for indigent care, provided at very low cost, and save the city more than $50 million in terms of construction. In addition to that, the cost of transition, from the present facility to Meharry would be no more than what it would cost to stay there over the next 5 years and to do renovations and things that have been proposed. The third thing, of course, is that operationally, this proposal would save the city 5 to 10% a year in the cost of indigent care. In other words, by combining the two facilities, the city would actually save on what it would cost to operate that service. And that's why people have been supportive of it. It is a solid proposal. Now, there are several obstacles that we have had to overcome and that we continue to deal with in terms of, some of them just relate to the history of the situation, some of them to stereotypes that have been developed over the years, but I must say this community is overcoming those.
Now, what do you consider to be some of those stereotypes over the years in reference to that might mitigate against this proposal?
Well, let me give you the brief history of this situation. We mentioned in the first segment that Meharry opened in 1876. The city first opened a city hospital in around 1890. Meharry requested access to that hospital in 1893. Meharry, because of its mission in terms of health care for the poor, considered it a natural to be involved in providing services in that hospital. So in 1893, President Hubbard requested that, and that was turned down. And it was purely, racial. There was no, people didn't try to hide those things at all then. In 1910, after using an infirmary for several years, Meharry started the construction of Hubbard Hospital, and by 1916, that construction was completed. This was all in South Nashville. In 1931, Meharry moved from South Nashville to North Nashville and constructed the old Meharry Hubbard Hospital. In 1948, because so many of the patients in Hubbard Hospital had no way of paying for their care, over half of them had no way of paying, Meharry was losing a lot of money in Hubbard Hospital. The Board of Trustees of Meharry met in 1948 and voted that the hospital be closed. That was in the headline in the paper the next day. The City Council met, they called the hospital board into session, and they asked that Meharry not close the hospital, that the city needed the hospital for the care of the indigent, and that the city would begin to reimburse Meharry for the care of the indigent. And since 1948, that's been a struggle to try to get the city to reimburse Meharry.
Even though the city made that kind of commitment, commitment in order to keep Meharry from closing earlier.
Exactly. But now, things changed in this country, and in the late 1970s, we got Medicaid and Medicare for the care of the poor and the elderly, and a lot of people thought we were going to have a national health insurance. So in the early 1970s, Meharry decided to expand this hospital, and he constructed the new towers, which we have over there now, up to 400 beds. But then by the mid-1970s, it was obvious that we were not going to have a national health insurance, so Meharry first then proposed that the city lease Hubbard Hospital for the care of indigent patients, because General Hospital was already in bad shape. That proposal was turned down. In 1981, Mayor Fulton appointed a commission to study health care in the community. That commission recommended that the hospital be closed and that the patients be sent to Meharry and or Vanderbilt. So that's sort of the background. Meharry, as an institution, received access to General in terms of serving there along with Vanderbilt in July of 1985, and has served since that time. It has gone very well. We've had no negative reports about Meharry's involvement in General Hospital. We've had physicians there, we've had residents there. It's been a very positive relationship. At the same time, as you know, Meharry now runs the Murfreesboro VA Hospital. Not only has that been a very positive working relationship, but last year, a Meharry faculty member won the top award in the country for physician services to patient. They call it the Hand and Hearts Award. The top award in the country went to a member of Meharry's faculty for our work at Murfreesboro VA Hospital.
So you've expanded your operations not
Exactly.
only here in Nashville, but also in Murfreesboro.
In Murfreesboro, Tennessee.
Now, what great advantage does that bring to Meharry in terms of its medical operations?
Well, it brings great advantages in terms of our educational programs, because our residents are trained at Murfreesboro VA. They provide the care there along with the faculty, and our students in that fourth year and some in the third year receive some of their education there at Murfreesboro VA. So it's helped a lot. Excuse me, prior to that relationship, we only had Hubbard Hospital, and we were limited to that. So in the last 5 years, we had a VA hospital, and we are involved in the Nashville General Hospital.
And of course, it allows you to expand your service, your teaching, and et cetera. We're going to have to take a break here, Doctor, but after which we'll come back in this last segment, talk about some of the things that Meharry is involved in terms of its international outreach. Perfect. And we'll be back with you following this commercial break.